Tell about what your neurosurgeon floor's been converted to at Mass General.
Yeah, so our typical neurosurgical floor is now a COVID-19 only floor, and that's been done in the past week or two based on the amount of patients that we're seeing on a day-to-day basis. The hospital, we're a 1,000 bed hospital, so we have a lot of space typically. But right now, because these particular patients need such special care and such very minute and fine resource utilization, our neurosurgical floors are equipped with that. And so the hospital made a decision to turn it from what we would do, brain tumor, spines, and all those post-op patients, to now being one that manages these very sick and vulnerable people with COVID-19.
What are you seeing on the ground at the hospital?
I am seeing a steady rise of patients coming through, and I'm seeing more people pulled from different parts of the hospital who may not be directly connected to dealing and treating upper respiratory infections or pulmonary diseases often. But I'm seeing them being pulled to sort of man this fight. But this is what we signed up for. We have to be doctors first. Do no harm, take care of the most sick and vulnerable folks who come through. And, I had no issue doing it, and my colleagues don't either. We have some wonderful people at this hospital that are really just putting aside their own personal priorities and putting these patients first. And that's really a remarkable thing.
How does what you're seeing currently compare to what you would have ever expected when you first heard about the coronavirus?
I think it's a lot more serious than we even anticipated as medical professionals. And when I hear folks say, we can have 100,000 people lost from this, we can have 200,000, these are just numbers, right? I mean, they just sound like numbers, but when you're working in a medical professional field, these numbers are real people. They have real stories, real life, they have families. And so that's something that I think medical professionals are dealing with. And that has really, I think, hit us the hardest, that, these aren't just, whimsical numbers that people are throwing out in the air. These are real stories of patients who sometimes don't make it. And for a hospital as big as ours, with as much manpower and wonderful, brilliant minds walking around, we're stressed, we're strained, our resources are limited, our masks are being dispersed to every person in the hospital and not in the location that we typically would have it. We have to reuse our operated masks, often, and we have to learn how to gown and make sure we conserve the things that we have, because we're not sure if we're going to be able to, keep the supplies and keep the resources and the equipment available when that surge does hit. So yes, it's going to get bad. It's going to get worse, and it's unfortunate, but we just have to be creative, find ways to be smart about keeping the providers healthy so that we can continue to have people volunteer and in the fight. If you remove people from the fight because they're all sick, then that's really going to leave the patients in harm's way.
How frustrating is that for you and your colleagues?
It's frustrating because it's not something that you would prepare for. But these nurses, I mean, they see the patients over and over and over again. They are exposed and then re-exposed and then re-exposed all the time. And so them going home to their family, potentially getting their kids sick or their husband or their wife sick, this is a real thing. And so I'm glad that, again, people are noticing, calling attention to the fact that there's a shortage of resources. And hopefully with that, the spirit of America and the spirit of unity will find those other creative methodologies to help us in this issue, because I can see it getting bad, even at Mass General, but certainly at those smaller community hospitals with not the staff that we have here.
How exhausted are you and your colleagues right now?
We are rather exhausted. We have to work 24-hour shifts now. If there's a case that's going on, we're getting called from home to do it, and it's been taxing. And when you're not around your fellow men and women who you're around all the time, you've been around for the last 3, 4, 5 years in residency, it can get draining emotionally too. When you have to seclude yourself from your family because you don't want them to get sick. That's draining as well. So, my family is in Florida or the Bahamas. My wife is in Alabama. So, we're disconnected, unfortunately, right now, just on a physical level, which may be a good thing. We're physically distanced. We're really physically distanced, miles apart, states apart, countries apart. Nevertheless, I get on the phone with them, FaceTime with them, try to see them, talk to them about their stories, laugh and joke, get my mind, like my colleagues do, away from this issue, so that when it's time to recenter and get back in the hospital and fight this fight, that I'm geared up and recharged to do so. My family does that for me.